because we walk around, stand, and do various activities standing during our regular daily lives, gravity always tends to pull the blood to the lower extremity. And the only reason why blood continues to go up to the heart against gravity is because of the valves in the veins. And the valves in the veins promote the blood to go from the legs back to the heart.
Valves are very important to maintain lower pressure in the venous system and allow a one-directional flow of blood. If they fail, there's a two-directional flow, which is abnormal flow back towards where the blood came from.
Chronic venous insufficiency is a very common condition. It affects a third of the adults in the United States. There's a variety of problems that can affect the venous system that can cause chronic venous insufficiency. Valve problems are one group of pathophysiological processes that affect patients with venous insufficiency. And we have a variety of treatment to treat superficial venous reflux, which is abnormal valves in the superficial veins. But so far, we have not had any surgical treatment for deep valvular reflux.
These patients have high blood pressure in their venous system, and so that can lead to skin problems, even ulcers, and the worst case, they can have severe infections in these ulcers.
They have constant pain in the leg, which is very uncomfortable, oftentimes to the point that they actually have to quit their jobs and become disabled.
The SAVE trial, SAVE is an acronym for Surgical Anti-Reflux Venous Valve Endoprosthesis. SAVE basically brings a totally novel treatment to deep valvular disease. It allows us to implant a bioprosthesis. It's a metal frame that contains a surgically sutured porcine cardiac valve on it. And basically it helps the blood flow to go back up when it's implanted in this position. And when the blood tries to go down back to the legs because of gravity, that valve opens up and holds it. And with this happening, there's less blood refluxing back to the legs and staying in the legs.
The procedure is relatively simple. It does involve an incision in the middle of the thigh where we expose the femoral vein. And then the valve is surgically implanted into the vein. By that I mean that there's a small incision made in the vein. The valve is implanted and then sutured in place. And then the incision is closed and the patient recovers for probably about 1 to 2 days, hopefully 1 day in the hospital before going home.
Gravity is really your enemy in that disease. The SAVE trial brings in totally new and a game changer for patients with deep venous incompetence and valvular problems.
Our hope is that we can actually get the patient almost to a cure so that they no longer have to contend with high venous pressures you see in chronic venous insufficiency.
If you have wounds in the leg, you have swelling, please come for evaluation. You may be a candidate and it really will improve your quality of life.
We're able to help you as a patient to fight gravity and get your blood going back to the heart as it should normally go.